All around the world, there are so many users of wheelchair, which not just for patient who has paralysis, particularly on legs, but they could be other as well. In some special occasion, some wheelchair users will accept the offer of a helping hand, but sometime person uses wheelchair prefer to remain independent. Because for them, nursing diminishes their quality of life, when they do not have freedom to move around. Therefore, most of the time, manual wheelchair users have to propel their wheels hundreds, or maybe up to thousands rotations with their arms churning, shoulder lurching and wrist twisting for the essential grip on the handrim of the wheelchair just to ambulate along a city block. It is why, manual wheelchair users have high rates of carpal tunnel syndrome and shoulder injuries. To overcome these situations, motorized wheelchair is used, and a controller is needed, in order to move a motorized wheelchair. However, the wheelchair's controller these days are not user-friendly, and difficult to use. In many cases, therapist is required to guide the users so that they could move the wheelchair using the controller. Some controllers, which uses the head and chin to control the wheelchair, may suffer the difficulty instability, especially when the users are traveling in an uneven road, and might cause the wheelchair moves in an unintentional direction, which may endanger the wheelchair user. Some controllers are not particularly robust, and could be broken down when the force exerted onto the controller was too much. Although the controller is replaceable, the wheelchair user is immobilized during the meantime to repair the controller. Therefore, to further increase the mobility of the users, an extra wheelchair interface can be added in, which is the N accelerometer-based wheelchair motion controller.